Hey everybody, welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas, and this is the first ever Carcast. I am here with my good friend Tiger Savaroff and his co-worker, Liz. Liz, what's your last name?
Martinez.
Liz Martinez, all the way here from Chicago, Illinois. We are driving to my Chino Valley, Arizona practice, and I'm taking them around town. Tiger is actually going to be working with my team on some inventory control. He is the owner and founder of Zen Supplies, based out of Chicago, Illinois. And yeah, we're just spending some QT together. How you doing today, Tiger?
Awesome. Just happy to be here.
All right, so here's my main goal. My main goal is A, to get us to our destination alive.
Yep.
And B, to record first ever Carcast, and C, to actually put out some decent content. So, how about that?
I'm down for all three.
Okay, sounds good.
We can accomplish.
So you flew in yesterday. You are a traveling machine these days. You flew in yesterday, and you got to hang out with my good friend Gary Takish yesterday.
Yep.
You got to see his practice right there in Phoenix, Arizona. Tell me about how your day was with good old Gary.
So Gary is very, very impressive. You know, I told you about this yesterday, Mark. I appreciate and I respect the people who put in the work and then talk about it. There are way too many people right now that talk, but like you said, they want to test everything on their clients so then they can go and sell that material at the higher cost. I hate that with my passion. I love Gary. I love that he's got his own practice. He's testing everything. And when I asked Gary, I said, Gary, give one tip to my followers on Instagram. He said, let's do this. And he said, hey, this is what you guys should do. You should all have Google reviews, and this is how you do it. And it was legit. It was true. This is 1, 2, 3 step how you do it.
That's
I love
just
it.
like a Tactical Tuesday episode. It's just
love
like,
it.
Here's something that you can tangibly take back to your practice and implement tomorrow.
100%.
Or today.
Today, the next second.
Yeah, I like Gary a lot. He's a kind person. He's a gentle soul. I was lucky enough to speak on stage with him at the Voices of Dentistry, and that was actually, we were in the same sphere for a lot of years. And that was the first time we met in person. So shout out to Gary Takish. I'm glad you got to hang out. Today, you're on my podcast. So you got to hang out with Gary yesterday. Today, you're on my podcast. Tonight, you're going to be on Howard Ferrand's podcast, right?
It's busy. It's a busy trip.
It's almost like, when you write a book and you go on media tour.
Yes.
Right? So
the problem is I don't have a book, so maybe I should fix that.
But you have a very, very successful emerging company. Tell us about Zen Supplies for the people that didn't catch it. Just a quick update on what's happening in your world and a little bit about your company.
So we have a huge passion for transparency.
What do you guys think of this landscape, by the way?
I was just looking at it.
It's gorgeous, isn't it? So we're just driving by our lake and mountains here in Prescott, Arizona. There's somebody kayaking there.
Maybe we should stop and do a podcast on a kayak.
Yeah, a kayak podcast.
Exactly.
Kayak
First ever
cast.
kayak cast.
Yeah, there you go. So, I'm sorry, didn't mean to.
Sure, yeah, of course. So Zen Supplies is going strong. So we're the inventory management system, and our goal is to simplify that process completely so that you don't have to rely on Susan, who's one of the best dental assistants, and she accidentally forgot to purchase Heavy Buddy. Yeah. So that's our goal, is to make sure that it's all organized, and our slogan is "Let's get organized," right? So I love that part. I love being organized, and I think that with just a little bit of implementation set up, all the offices can get organized with Zen Supplies. And now the side product or byproduct of us getting organized, now we have price comparison.
Yes.
So for example, if you're a huge Patterson fan or Shine fan or Banco fan, which is all good companies, maybe except one of them, and
we won't say which one.
Exactly. Ends with an S, right? Or N. So if you're one of the customers, you can continue using. Zen Supplies doesn't mean that we're going to replace. So for example, when offices ask me and say, so now I'm not going to use my Shine Wrap, I said, well, if you buy groceries, if you bought a Samsung refrigerator, it doesn't mean that you're not going to go to Trader Joe anymore.
Right.
Right? So it's the same concept. So Zen Supplies is like the refrigerator in the office, but it doesn't cost you as much as the refrigerator. And we organize it, we get it all in one place, and now when you have an entire order ready to go, this is beautiful.
It's gorgeous here, isn't it?
It's amazing.
Now you see why I live in this beautiful city.
I think we're moving. All right, so now officially the headquarters of Zen Supplies is moving to Prescott, Arizona.
I know, people are always like, why do you live in such a tiny little town? I can live we can live wherever we want. In fact, our practices are all over the place. Most of them aren't in the town that I live in, but I just love it here. It's simple living. I drive a pickup truck. You guys are in it right now. I drive a Chevy pickup truck. I don't drive a BMW or a Porsche or anything. In fact, in this little town, people look at you funny if you drive something too nice.
Really?
They're just good down-home folks. I really like, getting brought back down to earth. We call it the reverse Superman, right, Ashley?
Yep.
So I get back into town, and I speak at an event, and I'm on stage with 500 people, and people are very, very nice and gracious, and I get a lot of stuff paid for, my hotel rooms and my meals, and they pay me to be there. They pay for my travel, and I get back to Prescott, Arizona, and not even the dentists in town know anything about me.
Yep.
I'm just a regular dude.
Yep.
And I like it that way.
It's humbling, right?
It's totally humbling. And by the way, Ashley and my wife Leslie would never let me get a big head anyway. So even if I tried really hard to be the man, it would never work out. So anyway, I like the whole idea. Back to business. I like the whole idea of inventory control. And you mentioned something last time that we were talking about when we were talking about your company. And I preempted the girls, my orders, to the two practices that we're visiting today. And I was trying to explain it, and frankly, I don't know enough about it to explain it well. But I told them that we were going to be able to know exactly the dollar amount of the inventory that we currently have, and then when we run out of a certain thing, or even before we run out of a certain thing, we're going to be alerted by the software that it's time to order. That to them, I mean, you should have seen their eyes. They're like, that is the coolest thing ever, right? Mm-hmm. Mm-hmm. And then now we have 10 practices. I would love to be able to look at a dashboard and say, at any of my practices in any state that we happen to be in, because we're about to go more towards the middle of the country, we're buying more practices outside of Arizona and California. I would love to be able to just take a look and see how we're doing inventory-wise. I mean, from a CEO's perspective, that to me
it's
is
huge.
What really attracted me to your company.
Mm-hmm, mm-hmm.
Yeah.
So, just a side note on that, very quick. I shared with you some of my frustration yesterday that we're a small company, we're growing, we're obviously on the feedback collection mode, right?
Yes.
We're constantly seeking out for offices to tell us this works perfectly, this stuff does not work. So, for example, one module here, you guys really suck, change it. And we're in that mode. We're very quick to change, we're very quick to adjust. But I'll tell you this, it's so interesting to see some of the dentists in the country. They will look at our system and they will say, so I will only save $150 in an order? I don't know if it's worth for me. And I'm looking at it and I'm like, not only you get a system and then you're saying that it's only $150 on the same products that you're going to be buying,
right.
That's just mind-boggling to me. That whole motion needs to change. I mean, the dentists need to become the business people.
Yeah, and I think I'm not trying to throw anybody under the bus here, but I think there's just a general lack of knowledge, lack of education when it comes to really managing overhead and cash flow in a business, especially a dental practice, because we want to focus on clinical stuff. That's what we're comfortable doing. That's what we were trained to do. So when you throw a P&L or a balance sheet in front of a lot of doctors, they gloss over and they don't want to deal with it.
Yeah.
They want to talk about clinical stuff, and if there's a problem with the business, they want to go and they want to get more new patients and they want to produce more. That's the knee-jerk reaction from most
or hire the coach who will test on them a couple things and then try to sell it to somebody.
That's right. So we'll cram more patients in the door, and we'll get more production, and that's going to solve all of our problems. But if you take the time to really, really focus on overhead and cash flow control first, it's crazy how much better a business will run. And then when you increase production, you get to keep all of that increased production, right? Instead of it leaking through your business like a sieve. So, we often see, we like our practices to be, 4.5% for dental supplies of the total revenue. That's our goal in our practices. And eventually it's going to get down to 4 and then 3.5%, because we have some really great relationships happening now with some of the larger suppliers.
Right. Can I flip the table for a second?
Yeah, sure, please.
So let me ask you a question. At what point, let's just say your listeners, right? A solar doctor, maybe 1, 2, 3 locations doctor.
Yes.
At what point do you think they should look at their P&L, or what is it something that should alert them in the practice I don't know, maybe a full garbage can, or maybe they don't know the collection, or maybe they don't know that the software and the QuickBooks don't talk. What is it something that they should be the first red flag that they say, maybe it's time for me to get organized? Not necessarily Zen Supplies, like we'll come to that later,
just
but like
a 10,000 foot view, So first thing is, you know, you got to be able to answer some very, very basic questions, right? So you ask any dentist that you pull off the street, you know, do you know the analytics of your practice? Do you know the KPIs of your practice? And they'll
What's
say, yeah,
KPIs?
Key performance indicators of your practice, right?
Yep.
So they'll say, yeah, I know that I produced $100,000 last month. I know that we collected $85,000, and I know that we got 16 new patients. Well, those aren't KPIs. That's just the very bare bones basics. And then you go a little bit deeper and you say, okay, what was your profitability last month? What was your overhead last month? What percentage did you spend on lab? What percentage did you spend on payroll? What percentage did you pay on dental supplies? And we always like to focus first on the variable expenses.
Yep.
And the easiest to control are dental supplies and lab fees, right? So we see it all the time where people are like, oh, we're at 9% for dental supplies this month. That's not that big of a deal. We're only 4% over. 4% on a $100,000 a month practice is $4,000 a month and $50,000 a year.
Yeah.
You know, that's a huge deal.
So what are the 5 KPIs they need to know? Let's just start with that.
Payroll should be 25 to 30%. I like to do 30%.
Okay.
Because I like to hire the best people in the area.
Okay.
Lab fees?
Lab fees?
Should be 9% or less.
Okay.
Dental supplies should be 5%
or less. Yep.
Office supplies should be
1% or less.
2.5 to 2.5% at the most.
Okay.
So that's it. I mean, those are the variable expenses that you can control starting tomorrow. And I feel your pain, because when somebody says, you know, I'm only saving, you know, a couple $100, $300, $400, it's not worth all the effort to change suppliers. It's like, what? That's 2 percentage points, which is $2,000.
Yeah.
That's insignificant.
Mark, you know what I'm more worried about is not so much that people are looking at the percent. Let's just say they say 1% or 2%. I think what I'm worried about is the mindset. Sure. If you're saying, well, I'm not so concerned about 1 or 2%, then I want to look at everything, because most likely everything else is not in line.
Sure. Yeah, it's absolutely true. You take a really hard look, and that's why we do things the way that we do at DSI, because I don't like looking at P&Ls. I don't like looking at things that aren't broken down into very specific categories, right? So the way our coaching sheet and our scorecard looks is, it'll say, okay, this is how much you spent on dental supplies this month. This is what percentage that was of your gross. This is the industry accepted average for that particular category, and here's how much you are over or under by.
Yes.
It's either black or red.
Right.
So I glance at our scorecards for all 10 of our offices. I can do an analysis in 3 minutes for all 10 offices.
But let's just say when you're just starting out, right? Let's just say a Dr. Awesome out of, I don't know, somewhere in Chicago, Illinois. Okay. I'll just throw it in.
Yep.
They listen to us right now talking. They're like, I'm trying not to swear, but like I'm trying my best. So they're looking at it and say, okay, I have to start.
Yeah.
What would it take them to start? Is it going to be 30 minutes every day extra, staying over, and then looking at the spreadsheet, looking at the QuickBooks, looking at Eaglesoft or Dentrix or Open Dental? What's going to be that first 30 minutes? Good
questions. Okay, so if I was a brand new doc, first thing I would do is make sure that you were getting monthly, this is huge, monthly P&Ls from your CPA.
Okay.
Or your bookkeeper, not quarterly, and they're all going to want to give you quarterly P&Ls. Monthly P&Ls. I don't understand how you can analyze and react to something that's happening to your business if you're only seeing it every 90 days.
Insane.
It's crazy.
Yeah.
I mean, I look at stuff daily, hourly.
Yes.
And
adjust.
And many CPAs out there want to give you information every 90 days. It's crazy. You can't operate that way. So the first thing I would do is figure out how to read a P&L and a balance sheet, how to calculate your overhead, and then make sure that you get that reporting.
Can we have you record like a YouTube video where you teach people how to read a P&L?
Oh, sure.
And say,
but
1,
you know what?
2, 3,
I'll tell
4.
you what, even better than me, if you go to Khan Academy, profit and loss statement, he'll explain that. If you go to Khan Academy, this is on YouTube, Khan Academy EBITDA, they'll explain EBITDA. I think it's KAHN, I think. It's all free YouTube videos. They have the best business section.
We need to link it up
on YouTube. Yeah, we'll link it up on the show notes. But yeah, I mean, balance sheet, 15 minutes. If you never knew how to do it, you don't have to take an economics course. All you have to do is watch some of these quick videos. They can explain it much better than I can.
Okay.
In fact, when I was first going out, I used YouTube all the time for stuff that I didn't understand.
Really? You didn't go for like a $1,500 course?
No.
Wow, shocking.
Yeah, I don't have time for that. So that.
And back then, you probably didn't have money to do that either.
No, I didn't. I didn't have the resources to do that. So those are the things that I would do if I was straight out of the gate. You got to be educated in how to read the basic reporting in your practice, and then if you guys want, do a little bit more research. It's all over the internet. Just say KPIs for a general dentistry practice.
Wow.
Google that.
Yep.
And you'll have a million different sources that'll say, 5% for dental supplies. Some people say 9% for lab fees. And I will tell you this. I heard this from my good friend Scott Luna. A lot of times when people have a CEREC machine or they're doing a lot of implants, it's very difficult to tease out the difference between a lab fee
and a supply. Yep.
So what Scott says is it's acceptable if both of those two line items are bundled together and you're under 14%.
Okay.
So that's a little tip that I learned. See, I'm learning every day too.
That's perfect. Yep. So I actually did want to ask you that question because some of our clients are asking that as well.
Yep.
So all the blocks that you're buying for CEREC, they would go, it doesn't matter where they go, either lab or the office supplies, as long as it's under 14% altogether.
That's right. And what I would suggest is, you still want to get it as clean as possible. So some people are going to call, zirconia blocks a lab fee, right? Some people are going to call that dental supply. I don't care. Just be consistent and don't jump from one category to the next from month to month. Just be consistent. Then you can get an idea of if you're going up or down. I still like to take each of those items individually, 5 and 9%. But if it's just really confusing because you're using CEREC or you're doing a lot of implants, just do the 14% threshold. Yeah.
And so, again, I just want to make sure that we go through this very quick. What's going to be the first step for an office to take their overhead from, let's just say, 70 to 60%? That's just stage one, right?
Yes.
Without maybe like going way too much on this, maybe like 1 or 2 steps that offices can do. Like, again, somebody in this was an associate, bought a practice, first 120 days, something we talked this morning. Like, what would be something that they have to do?
Yeah. So what would be the first? Like I said earlier, the first reaction for most dentists would be, I got to double my marketing budget. I got to double the number of new patients, and I got to increase my revenue or my production by 25%. That's gonna decrease my overhead. True, it probably will decrease your overhead, but the first thing you got to do is
decrease the overhead.
Yeah, I mean, is to look at your variable expenses and make sure they're in check. And if they're not, it's time to shop, right? So I would. I don't know if you've heard me mention this. I mentioned it at the summit, Tiger, but I would take every invoice that you get from every supply and office supply and dental supply in your office.
In the lab.
And the lab, yep. And I would put them in separate folders, and I would itemize and create an Excel spreadsheet for the cost of every single item, right? So A1 flowable comes in a package of 5, and it costs this much, packable composite C1 comes in a package of 10 and it costs this much, right? Matrix bands come in a package of 25 and it costs this much. Do that exercise, or have one of your assistants do that exercise, and you will be astounded at how accurately you can, or how effectively you can negotiate with vendors once you have that type of
Would you say, Mark, if you don't mind, would you say that this one tip that you gave, right, can help people? It's like do this one thing and you can have 5, 6, 7, 10 practices. Like this one overarching step that you have to do, because it will help you to get control, and then that will help you essentially to build those skills to have multiple locations.
That's true. I think so. I mean, it's a huge part. It's a huge part of understanding your business. You know, I joked at the summit when I was on stage, and I was talking about this very thing, that McDonald's knows how much a sesame seed costs.
Yep.
Right?
Yep.
They know how much one piece of lettuce costs.
And nobody's joking about this at the meeting room when McDonald's sit down to talk about the...
No.
Yeah.
No,
and for some reason we joke about it.
But how come we don't know exactly how much it costs for the materials and the lab fee and the staff and the utilities for 1 hour of chair time to prepare a crown?
I think I know why. Because
it cost me $109, including staff and utilities and power and everything. I know that.
That's crazy. But I think the problem is, first, dentists are trained to be dentists, which is great. Second, the industry put it some kind of like a very interesting scene for the dentist that, hey, if you don't know how to do this, you can hire a consultant. If you don't know how to do this, the Patterson rep can help you. Like, there's so much stuff, and then you just expect that people are going to help, which is not the dentist's fault. And that makes you wait for the red or the blue pill to take, and all of a sudden you have 10 offices.
Yeah, it's crazy. I mean, the more that you understand the small minutia in a practice, in your single flagship practice, the faster you can multiply yourself, if that's what you want to do. But if not, there's no downside to having a really, really solid background in business and understanding how to run a practice. So we just pulled up to my Chino Valley office. That was, how long did that take, Ashley? We've been in the car for about 20 minutes-ish. So, Tiger, why don't we wrap this up? And perhaps we will have another quick 10-minute episode, Tactical Tuesday, when we get back to the office.
Yep.
But how about wrapping this up? Let's put a nice little bow on this topic of supplies and overhead.
Just like you said, I would much rather work with somebody who's in the right mindset. If you're not sure why you need this and all this does not make sense, I don't think it's time for you.
Sure.
It's the same as you probably would not want to get somebody who would expect everything that you guys will do. Like, you would want somebody who has a little bit skin under the game, right? The dirty nails, they did try a little bit, and then they come to you and say, I really struggle with 1, 2, 3 things, and then you help them. So the same with us, that we're a technology company, we're growing, we're adding, we obviously want to have more offices, but when somebody calls us and they say, I don't know if I really want to be at 5% overhead on dental supplies.
Or it's not a top priority for me.
Yeah, and it's not a top priority. Or I don't know if I want to train my team to do this. I don't want to buy an iPad for my office. Or Shine Rep is my buddy. We're not the right fit. Yeah. So be in the right mindset. Understand where you want to go. Especially if you want to have 3, 4, 5, 10 offices. You have to be in the right mindset. And then I would love to talk.
Awesome.
And help.
Awesome. Ashley and Liz, do you guys have anything to add?
To be totally honest, I've been working in the back seat, so enjoy your, what is this, Tactical Tuesday episode?
No, this is just a regular Big Thinker Thursday.
Sorry, well, I just got put on the spot. Maybe we'll edit this part out.
Liz?
No, this was awesome. Watching you guys do all of this, I'm learning a lot of stuff just listening to you, so this was great.
Awesome.
Thank you, Mark.
Okay, guys, so that's all we got for you for this episode. Thank you so much for joining us for the first ever Carcast with my Russian friend, Tiger Safarov.
Loved it.
Have a great day, guys. Bye-bye.